Well, good day and welcome to the show. I'm Maggie Linton. The college basketball world has lost another Hall of Fame coach. Jerry Tarkanian led the University of Las Vegas to 4 Final Fours, winning it all in 1990. He also coached at Long Beach State and Fresno State. He had been ill for quite some time. Tarkanian was 84 years old. Later this hour, former Teacher of the Year, educator, and New York Times bestselling author Sharon Draper with her new novel, Stella by Starlight. But we begin the hour with a new procedure for reversing hair loss. Joining us to discuss the hair-growing laser helmet is Jeff Braile, president of the Medical Products Division of Apira Science Incorporated. Welcome, Jeff.
Thank you, Maggie.
Listen, when I first heard about this, I thought, geez, that's a pretty good deal. Talk about the helmet, but even more so, talk about how you learned about the helmet and got it rolling and helped develop it. Not you personally, but I mean your company. Yeah.
Absolutely. Well, we originally basically have been in this business for about 10 years. We used to make kind of a hooded laser that physicians and high-end hair studios used in their office, and people would have to come in and sit under it. And we realized that there was an opportunity to make this into a home-use device that would be much easier to use, equally as effective, and get better results because compliance is very important in this. You have to stick with it, especially during the initial 16-week period. So we got together and worked on drawing up some possible options and got together with our scientists, and the iGrow was born.
So many people suffer from, either slow hair or hair loss and things like that. And but the stimulation by the lasers was something that had been kind of worked on for a while, right?
Absolutely. First of all, to answer your first question, there's 50 million American men and 30 million American women, according to the American Academy of Dermatology, who suffer from hair loss, genetic hair loss. As far as the stimulation using low-level light therapy, yes, it's used in a number of different situations, carpal tunnel syndrome, pain management, wound healing, and then for the face for things like wrinkles, acne, and hyperpigmentation. And what we did was we realized that those principles would be applicable if you use them for hair growth, and we designed the iGrow and conducted clinical studies, got our FDA clearances for both men and women.
So as we look at it, because I went to the website and checked it out. It's iGrowLaser.com/radio. It comes with it truly is a helmet, but it comes with headphones, kind of to help protect the ears. Is that what it is?
Well, two functions. First of all, it's to help stabilize the helmet on your head. Secondly, we decided that if this is something you have to do on a continuous basis, you might as well be able to plug in your iPod or MP3 player or even take a phone call while you're doing it. So they're actual working headphones.
And that's pretty cool. Thinking ahead, you were.
That, we thought we'd add the entertainment function.
Yeah. Definitely. Well, talk a little bit about how it works and how much you have to do how often you have to wear it in order for it to really get that growth going, because you have have had some success with it.
A great deal.
Yeah.
And the way it works is kind of an analogy is when I'm fair skinned, and when I go out in the sun, the UV rays of the sun don't make my skin red. They damage my cells, and too much sun damages your cells, and the chemical reaction that takes place is redness and all the other things that are associated with sunburn. This light at this specific wavelength is a healing light, and what it does is it stimulates your cells, it excites them, and when they're excited, they function at a higher level. So when you take the way you lose hair, because how people lose hair is the follicles start to close and you get thinning, and then eventually you have hair loss. So this opens up the follicles. You get thicker hair that comes out and new hair growth from those follicles.
And so it's just a constant stimulation that goes. What time length are we talking about?
The initial treatment period is 16 weeks, and during that time, you want to use it for 25 minutes a day, every other day. After that, everyone is different. Most people can get by with just once a week.
Oh, that's pretty good. It's really a buckle down for that first 4 to 6 months, and then after that, it's yours.
Well, a lot of people keep doing it because they love the results.
Yeah.
And so, and really, aside from the headphones, they're not noise canceling. You can watch TV, you can work on your computer, you can have a conversation. So, but it really is. If you look at other hair loss solutions that have FDA clearance, like take Rogaine, minoxidil, you have to consistently apply that at about the same levels for as long as you want to maintain your results. And at $25 or $30 a month, you're going to spend a lot more on that than you are on low-level light therapy.
Yeah, and plus, some people are allergic to minoxidil, and it doesn't always work. And then, if you're traveling, you got to take it with you. And it's just, it's a constant application sort of thing that really can get tedious and still see little or no result.
Absolutely. And the nice thing about this is it's safe. There are, people hear the word laser and they sometimes get a little nervous. But these are cold lasers. They're not the type that are ablative to tissue. So they don't cut, they stimulate. And there are no contraindications when using this. So there are no side effects.
Right. Once again, we are talking with anybody. In fact, if anybody has any questions, you're certainly welcome to call. We're talking to Jeff Braile. He is president of the Medical Products Division of Apira Science Incorporated, and we're talking about their iGrow laser helmet, which is really hair growing laser helmet, which is really pretty cool, folks. And so, as we look at lasers, how often? Well, as you look at it, the lasers, and I'm sure you went through a lot of testing. Have you had any complaints of somebody with a sensitive scalp, burns or anything like that?
No, this laser can't burn. The only safety is the same type of safety issue that you would have with any electrical appliance. Don't drop it. Don't use it in the bathtub. Don't drop it in the sink.
Sometimes it has to be told, doesn't it?
It does. And, we have people who try to use it because they figure out a way to plug it into their car. And that's just, this is your 25 minutes a day of quiet time. You can do your work, but it's just best to sit down and relax.
Yeah. Talk about some of the people and how much hair that they started. I mean, when you get a new product out, it has to be tested. And just finding the right people to get it tested. And how long was it, were the tests going on?
Well, we conducted clinical studies on both men and women, and separate studies. And during those studies, the papers were published, they were peer-reviewed. So basically, this has gone through the same type of scrutiny as the things that you would find in your medicine cabinet. And during the results of the study for men were a 35% increase in hair growth in 16 weeks, and for females, it was 37%.
That's pretty good.
And there were no side effects reported during any of those studies.
Yeah. That's the thing more than anything is the side effects. When I think of women in particular with their hair loss, so often it is also because of hormonal changes, because of going through menopause and things along those lines. And so you're even overcoming that and combating that.
Absolutely. And we were just featured on a segment on the Doctor Show, and the woman who was on was mid-40s, and she had just issues with her hair for years and years. And she tried everything and finally went to, got the iGrow. And if you look at the transition from her, and that's really what keeps us going, is we've transformed a lot of people. And when you see the results and you get the positive results, it really keeps you fortified. Because as you know, there's a lot of skepticism regarding hair growth solutions.
Oh, yeah, definitely. Lots of it. Because so many people, when I think about and it's still being done, people going and getting plugs. and it doesn't look pretty when you first get it started.
No, and that's the thing is, people think that the unit actually takes 16 weeks to work, but it's only because healthy hair only grows a half inch a month. Mm-hmm. So over a 4-month period, you actually get enough new hair growth and thickening of your existing hair that it can cover spots that have been, that have been in existence for a while. And if you're a man and you have a quarter size, spot on the crown of your head, or if you have one that's more about 3 times that size, you got to get a lot of growth to cover up that space.
Mm-hmm. Wow. So, what other medical devices are you all working on? Because I know this is probably one of the biggies, but you've been doing this for a while and really done well with other things too.
We actually have a series of products that are the first of which is going to be launched at the end of this summer. And what we try to do is, there are a lot of handheld devices for phototherapy. There are combs for hair growth. There are combs for your head. There are handheld devices with using light therapy that you have to manually move around. And what we've done is we've patented systems so that you can cover those surfaces, full surfaces, without any manual movement. So we've kind of automated the process. So the iDerma facial beautification system is the first, and that will be just for overall skin condition, wrinkles, fine lines, and just to give you a rejuvenate. It's kind of like a photo facial. A lot of women go to spas and get these photo facials, and the iDerma will be a photo facial that you actually have in your home, and you can do for as long as the device lasts you. Following that, there's also going to be a blue light treatment for acne, mild to moderate acne, and a green and infrared light therapy for skin lightening.
That's pretty cool. It's amazing how far things have gone nowadays using the laser and laser technology, because lasers now are even used in surgery and other things and have really proven to have very few, if any, side effects.
No, as I said, our product has no side effects. Mm-hmm. And these, there's some really interesting work going on. They're using low-level light therapy, LEDs, to treat Alzheimer's and brain trauma. And there's some really promising work that's taking place in those areas.
That's pretty amazing. Jeff, how did you get into it?
I was in the investment banking field, and someone came to me and showed me the first hairdryer-like device. I thought it was interesting and started to import it from a company in Sweden. And then it took on its own form. And when we decided to go to the home use market, which is really where most of these low-level laser and low-level LED devices really are proliferating, it just took on its own. We have some really interesting work that we're doing with some other products that are more on the medical side also.
Mm-hmm. Can you have been completely bald for a while and start out with something like this?
No.
Okay.
No. This is, we really like to manage people's expectations. Uh-huh. If you have hair loss, total severe hair loss, you've been bald, and the follicle is closed, if you can see a microscopic hair fiber, then that hair can be rejuvenated. But if it's shiny bald like Dr. Phil, you're not going to see it. You're not going to see any results.
That's the reason why I asked, because, somebody out there with no hair at all for a long time, like you said, Dr. Phil, Michael Jordan, we could name many of them, going to come up to you and say it didn't work. Well, yeah, it didn't, because after a while, it is completely dead. And there's no rejuvenation to be expected.
And at Apira, we offer a money-back guarantee for 6 months. And we don't want those kind of people using it, because it hurts our return rate.
Oh,
so
yeah.
we encourage people who, if you've been bald for 20 years, this iGrow is not for you.
Yeah. Exactly. Well, listen, I have to tell you, very interesting. As again, no side effects. Hair growth will start and continue to grow, and it makes such a big difference for hair loss and thinning hair. And it's something that people should look into. It's really an investment for a better way of life, isn't it?
Absolutely. I know a lot of people nowadays have started shaving their heads and things like that, but it's about 1 in 100 that has the face to pull off that look. The scalp is not always beautiful.
Mm-hmm.
There are divots and cracks and scars and all those kind of
and
things.
Ripples and rolls.
Yes, absolutely. You have it.
A friend of my husband, when he, that he worked with, I said it looked like a roller coaster on the back of his head because there were so many rips and rolls, and he shaved his head, and I thought, no, please grow your hair back, because it was the look,
And it's true, and especially when I'm in my gym and I'm on the elliptical machine, which overlooks the thing, and I just see all these men, especially, who are just starting to lose hair in the front or the back, and I really wish I could just give each and every one of them an iGrow to kind of change their outlook on life.
Yeah. Because they think they're headed for but because of them being young and still having those follicles, now's the time to start. So you never have to be like that.
No, absolutely, and and that's the thing. If you could keep your hair, if you could restore it and keep it for another 20 years, you're saving yourself from a lot of agony or a lot of just unpleasant times.
Well, and even though you're going to have to pay for the haircuts, it's better than paying for razors. All right. Listen, thank you so much. Once again, it is Jeff Braile. He's president of the Medical Products Division of Apira Science Incorporated. Lots more on the hair growing laser helmet at igrowlaser.com/radio. Once again, igrowlaser.com/radio, and also on Facebook and Twitter, iGrow Laser. And we'll put the link up that will take you directly to some of the pictures as well as the laser on our Facebook page and also on my website. Thank you, Jeff. Good chatting with you.
It's a pleasure speaking with you. Thanks, Maggie.
And continued success, because I know a lot of people out there have those skin conditions too, and if there's anything that can help, bring it on.
Okay.
All right.
Keep working at it.
Thank you.
Bye-bye.
You don't need your eyes checked. You don't need to recalculate the total. And no one's pulling an elaborate prank on you. That number on your current satellite TV bill is high. Are you ready for a lower bill? Call 1-800-DISH today and switch to Dish. Dish provides the same HD service, gives you the same channels and the sports you love. They even offer others that other satellite providers don't, like no fee for regional sports networks and no first receiver fee. Why pay more? Well, it's a no-brainer. Dish is a better value. Stop staring at your costly bill and pick up the phone. Call 1-800-CALL-DISH and talk to a customer representative. One simple call can start saving you money. Get the same great shows and better quality service, all for a lower price. Call 1-800-CALL-DISH and switch to Dish today. 24-month commitment and credit qualifications required. Cancellation fee, monthly equipment fees, auto pay, and paperless billing and other restrictions apply. When we come back, Black History for Young People. But first, our salute to Black poets.
In honor of Black History Month, we celebrate African American poets with Adele Coleman Williams.
Homage to My Hips by Lucille Clifton. These hips are big hips. They need space to move around in. They don't fit into little petty places. These hips are free hips. They don't like to be held back. These hips have never been enslaved. They go where they want to go, and they do what they want to do. These hips are mighty hips. These hips are magic hips. I have known them to put a spell on a man and spin him like a top.